Hi, this is Dr. Mark King from the Motion Palpation Institute. I'm here to talk a little bit about lateral epicondylitis or lateral epicondylosis or lateral epicondylopathy. So it kind of depends on where it is. Obviously, itis means it's acutely inflamed and osis means it's more of a degenerative problem. So from a diagnostic standpoint, we learn in school about Cosen's test and the pain there at the lateral epicondyle on that test. We need to find out, is the elbow too tight or is it too loose, because it changes our treatment. If it's too tight, we're going to be looking to do our adjustments, obviously. If it's too loose, we'll think a little more about strengthening. Exactly where's the tenderness? X-ray is not particularly helpful for this. MRI is not particularly helpful. Maybe if they're failing care, then you would consider an MRI. But the Cosen's test, the history, those will give you the clues on this pretty quickly. So then from an adjustment standpoint, you are going to adjust those people that are too stiff, too tight, too locked up. But you need to think about the wrist, the elbow, of course, and the CT junction. Dr. Fay always talked a lot about the CT junction for lateral epicondylitis problems. Soft tissue is going to be very helpful here. And then the home stretches or PIR in your office for stretching out, especially the opposite side of the forearm flexors. Now, if you think about it from a locomotor chain, from a rehab standpoint, you can go right up and think about scapular stability. A lot of people find that's particularly helpful with these tennis elbow problems. Some passive therapies, cold laser, dry needling, shock wave, or radial pulse wave are all helpful. A lot of times the radial nerve is involved, so you can send them home with some radial nerve flossing. That can be helpful. We're more interested in kind of getting to the bottom of this, obviously, but tennis elbow braces and cock-up wrist braces, when people are actively using that hand, can often be helpful. So it's worth sometimes trying that. And I always talk about the anti-inflammatory diet and supplements being a component of this, because they just aren't going to heal as well if they're inflamed. So if they find, for example, that ibuprofen is helpful, then you know inflammation is at least part of this, and you can get them started down that anti-inflammatory diet and supplements for there. So those are just a few things to talk about with lateral epicondylitis problems, and good luck with that in your clinic. Thank you.